My name is Jake Cundith. This is my patient's consent form. All right, I'm gathering my materials. I've checked the recent health history and the chart of the patient.
Come in.
Hello, my name is Jake. I'm a nursing student. I'm going to be completing the second half of your head-to-toe physical assessment today. I'm going to give us a little bit of privacy. I'm going to wash my hands. Do you have any cultural or spiritual indifferences that are going to affect my ability to perform the exam on you today?
No.
Awesome. All right, go ahead and state your full name and date of birth, please.
Samantha Diaz, September 26, 1997.
All right, wonderful. All right, so if you could go ahead and sit up for me, we'll go ahead and start. Swing your legs over. Okay, do you have any problems? Do you have a fall history? Like, do you have a history of falls or anything like that? All right, how's your, could you go ahead and walk back and forth for me real quick? All right. Okay, I see that their posture and gait and swing is within defined limits, and I've also seen that there's no issues with falling, and their balance is great. You can go ahead and take a seat. Actually, can you stand back up for me? Sorry. We're gonna do range of motion real quick, so just imitate what I'm doing. Stick your arms out like this. Go down, up, down, above. Now do circles. All right, so what that tells me is that she has no issues with her range of motion exercises. And did you feel any pain or anything?
No.
No, that's wonderful. And also, when she walked back and forth, I noticed that the range of motion of her legs is with defined limits as well. She didn't have any issues or anything like that. And since you're standing up, we're going to go ahead and do your spine. So if you could just go this way and bend over like you're going to touch your toes. So I'm just going to check to make sure the curvature of her spine is within defined limits, making sure that everything is as it should be. All right, you can go ahead and stand back up. All right, so sit back down. Okay, I'm going to test your muscle strength. So what I want you to do is squeeze my fingers as hard as you can. Squeeze, 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 squeeze. Okay, go ahead, let go. Now push against me. Push, 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 push. All right, now pull. All right, you can stop. Now I'm going to do the same thing with your feet. Point your toes. Now pull up. All right, and what that tells me is that everything, her strength is equal bilaterally. Also, now I'm going to go ahead and do your reflexes. I'm going to do your tricep reflex first. So can you go ahead and completely make your arm limp? All right, go ahead. Can you make a clench twist for me? Let go. All right, now we're going to do the bicep. Here, let's do this one. And then we're going to do the supinator reflex. All right, now we're going to go to the patellar reflex as well on your knees. All right, now we're going to do the one on your Achilles tendon. All right. Okay, do you struggle with any pins or needles or any numbness at all in your extremities?
No.
Awesome. Do you struggle with completing your daily activities throughout your day?
No.
Okay, awesome. So next we're going to move on to gastrointestinal. So do you have any problems chewing or swallowing your food?
No.
Do you have any indigestion?
No.
All right. Do you have any changes in appetite recently?
No, not really.
Okay, and do you also have any changes in weight?
No.
Okay, what is your stool like? Your consistency, how often do you have diarrhea or constipation?
Not usually.
Okay, when was your last bowel movement?
This morning.
This morning, all right. Okay, so we're going to go ahead and inspect your abdomen. If you could go ahead and lay down for me. All right, if you lift your shirt up for me, please. So I'm going to inspect, auscultate, and then percuss, then palpate. So right now I'm looking at it, just making sure everything is symmetrical. I'm not noticing any pulsations or anything like that. And so next what I'm going to do is I'm going to auscultate. So I'm going to listen in the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. And what I'm going to be doing, I'm going to be listening for 5 to 34 vowel sounds per minute. And I will listen up to 5 minutes. And if I don't hear anything in 5 minutes, it means her vowel sounds are absent. So starting here. All right, and her bowel sounds were normal, active. So I'm going to go ahead and percuss the abdomen now in the same way that I listened or auscultated. So I'm just going to percuss, and I'm looking for a tympanic sound. All right, so now I'm going to palpate for any tenderness or pain or distension or masses. Are you feeling any pain or anything
No.
like that? Okay, moving on. She is in Erickson's intimacy versus isolation. You can go ahead and put your shirt down and sit back up. Do you struggle? Do you not struggle? Do you have any issues with your friendships or anything like that? You have good intimate life? Okay. Now, we're moving on to GU now. Do you have any issues urinating?
No.
Is there any blood in your urine, cloudiness? Does it smell weird at all?
No.
Okay, awesome. And so how often do you check your breasts for breast cancer for any lumps or masses?
Not usually.
Okay, so just a quick little education session on that. You need to make sure that you're checking for any lumps or bumps or anything like that in your breast once a month. You don't want to do that too close to menstruation before or after that, because it can affect the results depending on the tenderness of your breast and anything like that. Do you have any other questions or anything for me?
No.
All right. Is there anything else I can get you?
No.
Okay, so then what I would do is I would help the patient back into the bed. I would put the rails up. I would lower the bed all the way, and I would give her Caldwell and ask her if she needed anything else.